Knock, hand sanitizer. Hello, my name is Peyton. I'll be your NP today. I have a 17-year-old male here for an annual physical. Alright, so I'll just go ahead and start with a little bit of history. Any medical history or any sicknesses I should know about?
No.
Any surgeries in the past?
No.
Any family history?
Yes, some heart problems from my paternal grandmother, who also passed from cancer, and that's about it.
Alright, and then immunizations, up to date on all of those?
Yes.
Awesome. And I'm just gonna go ahead and get into what's going on in your life. How is home? What's your home life like, and where do you live? Who lives there with you?
It's good. I currently live at home with my mother and my brother in a regular multi-family home.
Alright, nice. And how about school? What's your favorite subject? How's that going?
Favorite subject is probably writing, like AP Lang specifically. It's going well.
Awesome job. Any extracurriculars or activities you like to do?
Yeah, I play soccer 4 to 5 times a week.
Awesome job, doing a lot of exercise.
Yes, indeed, both for high school and club soccer. Also in the Black Student Union.
Awesome job, love to hear that.
Yeah.
How about screen time? You spend a lot of time on your screens?
Yeah, probably more than I should. A lot of video games, a lot of phone time, TikTok. Yeah.
Okay.
Yeah.
We'll try to limit that to as much as you can, okay? And how about nutrition? Are you eating a good amount of fruits and veggies? Or, all right. What's your typical meal? Favorite meal of the day?
Of the day, my favorite meal of the day is probably breakfast. Typically start with some type of fruit, apple, orange, and then we'll get like a typical breakfast in bacon, eggs, some type of potato, and either a form of a sandwich or burrito as well. Some of my favorites.
Fantastic, love it. All right, and then do you or anyone you know use drugs, tobacco, alcohol?
No.
No, nobody?
Mm-hmm.
All right, fantastic. We'll stay away from that.
Yes, indeed.
And then, how about relationships? Any romantic relationships evolving, anything like that?
I do have a girlfriend.
Okay.
Yeah.
Sexually active?
Yes.
Are you being safe?
Yes.
Using contraception, condoms?
Yes.
Asking for consent?
Yes.
Awesome, fantastic. And so I assume you're identifying as straight, or am I? Okay. All right. Thank you so much. And how about safety? Do you feel safe at home and at school and everywhere you go?
Yes.
Safe everywhere you go?
Yeah.
Fantastic.
Yeah.
That's great. Well, I'm glad. All right, and then how about a little bit deeper? Any thoughts of hurting yourself? Suicide anywhere around you? Anyone you know?
No.
Having bad thoughts, anything like that?
No.
Mental health, how's that going?
Not too bad. Some anxiety with schoolwork, sports, getting ready for college and things of that nature, but yeah, anxiety.
Okay, all right. Well, please let me know if there's anything I can do to help you with that. Before we get into the exam, any concerns you have to report?
No.
All right. Are you doing your testicular exams and your breast exams regularly every month?
Yes.
All right, fantastic, as you should be. So we'll get into the physical exam here. I had, when you came in, my MA took your vitals. We have a heart rate of 75, which is awesome. Blood pressure is also great, 112/72. Respiratory rate of 18 is fantastic. No temperature here. We have 98.6, no fever. That's great. And then an oxygen saturation of 99%, which is awesome. You're weighing in at about 140 pounds here, and measuring up to 5'9". Really getting tall. All right, so I'll just go ahead and start with my exam here. I have a generally appearing healthy male here, normal stature, Tanner stage 5, obviously, and pleasant attitude. I'm going to go ahead and start with the face here. Are you able to raise your eyebrows? Raise your eyebrows, puff the cheeks. Awesome. Stick the tongue out. Side tongue. Awesome. Any issues doing that?
No.
Shrug the shoulders. Perfect. Turn your head to my hand. Awesome. This side. Great. Awesome job. All right. And we'll look inside the eyes here. It's going to be a bright light. I apologize. And some pupils are reactive and equal and round. Any issues with vision lately?
No, not too much.
Okay. Follow my finger here. Awesome. Eye muscles are intact. Love to see it. I'm going to look inside the ear. If I had an otoscope, I would look inside the ear here. Pulling up the pinna, looking inside, seeing a pearly gray TM. This side as well. Pull up, seeing a pearly gray TM. Any issues with hearing lately?
No, not at all.
Awesome. See that the ears are normally shaped and adequately positioned. I'm going to look at the nose here. It looks symmetrical on the face. I'm going to grab my light one more time. Look for patency here. And it looks like the nose is patent. Septum is intact. No issues with smell or anything like that that you know of?
No.
All right. I'm going to have you close your eyes. What do you smell here?
Smells like hand sanitizer.
Close enough. Alcohol pad. All right, you can open your eyes. I'm going to look inside the mouth. If I had an ophthalmoscope, I would be able to shine the light in your mouth, open your mouth real big, say, ah, awesome job. Tonsils are not enlarged, pharynx is erythematous. Any issues with the mouth at all?
No.
Seeing a dentist twice a year?
Yes.
Hopefully every 6 months?
Yes.
Fantastic. Keeping up with brushing and flossing?
Yes.
Awesome. Moving down, just going to feel for some lymph nodes here. No pain as I'm moving forward here?
No.
Awesome. All right. All of these lymph nodes are unable to be palpated, so that's awesome. We'll move on down towards the chest here. Take a listen to your heart. Right at the aortic. Pulmonic. Herbs point. Tricuspid and mitral. Awesome job. Heart sounds good. Heart is regular in rate and rhythm, and I don't hear any murmurs, gallops, or rubs. And then I'm going to go ahead and listen to your lungs on the front, and then I'll move to the back. Every time I put my stethoscope down, just give me a deep breath. Awesome job. Breath sounds are clear on all points in the front, and we'll move on towards the back. Last one. Awesome. Thank you so much. Breath sounds are clear and at all points, front and back, anterior and posterior. Any issues with breathing that you have to report?
No.
No issues with exercise, water, running, and everything? Everything's working out great.
Mm-hmm.
All right, fantastic. All right, so we've hit the chest, and I'll have you lay down on our exam table, if you will. I'm going to just unrobe your stomach area.
Okay.
Thank you. All right, so I'm going to inspect first. Skin looks intact, looks normal for ethnicity, warm to the touch. The stomach is flat. I don't see any palpations or obvious masses at this time. So I'm going to go ahead and listen first.
Yeah.
I'm gonna palpate here. Let me know if there's any pain.
Nope.
Nice. I don't feel any masses. I'm gonna get a little deeper here. Take a deep breath. Any pain there?
No.
Awesome. You can breathe normally. All right. I don't feel any masses. I don't see any tenderness or guarding happenings, which is awesome. I'll have you come on up, and you can actually come on and sit down. All right. I'm gonna check your pulses out on your extremities. No issues with your arms and legs. Everything seems to be working out fine.
Mm-hmm.
No crepitus or cracking or anything like that.
No.
Let me see your full range of motion. Awesome. Got the full range of motion there. Great. Wrists are working just fine. Awesome. And pulses are palpable +2s. I'm going to check for capillary refill. Normal capillary refill below 2 seconds. Awesome. And then I'll move down towards the legs here as well. Any issues with the legs at all?
No.
All right. We have palpable +2s here at the dorsalis pedis as well. All right. Okay. All right. Last thing is just a neuro exam. So I'll have you stand if you can, and we'll move this chair a little bit out of the way. And I'll have you, if you're able to, walk heel to toe for a few steps. Awesome, thank you so much, perfect. And then I'll have you bend on one knee, drag your heel down your shin with both legs, there you go. Nice. Awesome, looks good. And then I'll have you just raise your arms out, palms up with your eyes closed for a few seconds. Fantastic. Looks great. All your orientation is intact. Cerebellar function looks great. I'm just going to go ahead and have you put those hands right back out. Close your eyes again. What do you feel here? What did I draw?
Just an eye.
How about here?
An 8.
All right. Gravisthesia is intact. And I think that's really all I might have for you. You can have a seat if you like. Okay. So as far as guidance, I just want to reiterate again, just being safe, practice safe sex, please use the condom. If you need any assistance or education or any extra, just information about things like this, please feel free to come in. You're driving now, so please wear your seatbelt. Follow all the directions. If you need help with that, get help as well. Wear your helmet if you're on any other sort of vehicle, like scooters or bikes or anything like that. Please avoid drug use, alcohol use. Stay on top of your mental health. Please come in if you need help with that as well. Get that 60 minutes of exercise. Seems to not be a problem. You're playing soccer, which is awesome. Keep up with the dentist twice a year. Sounds like you're doing great with that. And the monthly testicular and breast exams, make sure to just, keep palpating around, make sure that you know what your normal is. And then nutrition, keep up with your fruits and veggies, get a lot of fiber in if you can, stay hydrated. And no vaccine this year. Woohoo! 17 years old, no vaccine. Unless you want your flu vaccine.
No, thank you.
All right, no flu vaccine today, no problem. So with that being said, you're free to go. Have a great rest of your day. Thank you, sir.